quickly, I would like to share with you that 6 of top 11 risk factors pointed in these slides are driving the global burden of disease, are basically related to diet. So if you see all the green bar are basically all those risk factors linked closely to diet. So another word that most of disease that is currently faced globally is driven by diet related factors. This is the common way of food and eating practices that scientists have linked to the contribution of intake of low or poor quality diets. More sugar and vegetable oils added to the traditional recipe, fast food consumption, dehydration due to less drinking water. Now I am assuming that everyone has uh, a bottle of water with you during this webinar, so to keep you hydrated. And then poor quality breakfast, I would like to give this question back to you. Have you had a good breakfast this morning? That could also reflect on much of these poor low diets or poor quality diets that we are facing, or I mentioned in this slide, is actually something that we also probably been doing. Yeah, skipping breakfast is something that we heard over and over, not only among our students but also probably among us, the parents. Frequent eating outside practice in way that it also jeopardize the cooking at home, that is becoming less and less practice. So all of these food and eating practices contributes to the problem that we have had in the slide that I presented in the slide before. Now, when we are talking about dietary practices, I gathered some information from Global School Health Survey from various countries among adolescent students, but for Philippines, the data came from uh, a bit younger population. So what is interesting, those practices marked red are basically practices that needs to be limited, yeah. But the fact a country like Brunei, Malaysia, and Thailand are reported to have over 40% of consumption of carbonated soft drink on a regular basis. When we are talking about regular basis, it means at least once per day. The next practice that needs to be limited is actually the visit or the consumption of fast food in a fast food restaurant. So dine at fast food restaurant. So we see here Philippines and Thailand also having over 50% of this practice performed by students. And by the often here we meant 3 or more days in the last 7 days, 3 or more times in the last 7 days. The next practice marked in blue were meant to address a good practice, so it has to be advocated, it has to be done more. Unfortunately, I have only access one country with breakfast data, which is Indonesia. It's only 35% that Indonesian students are having breakfast. So it means to say out of 10, 7 come to school without breakfast. That's more or less the analogy. In terms of fruits and vegetables, also the practice is low. For fruits, less than 20%, as shown by Philippines and Timor-Leste. When we say regular, it means 2 or more times a day for fruits. And for vegetables, regular means 3 or more times a day. And we notice that many of the countries listed in this table considerably having a low practice on fruits and vegetable consumption. And these are data coming from the students. So we can also reflect back to us as teachers, as educators, as parents. Do we also practice this as recommended?